Welcome into this week's Degrees of Science. We're all getting older. Unfortunately, nothing we can do about that. But how are you aging healthily? That's a big question. Well, today we're talking with Dr. Chitra Hamilton. She is a geriatrician from Baylor Scott & White Medical Center in Temple. So, Dr. Hamilton, a lot of folks, I guess the first thing you may notice as getting older is changes in muscle, maybe bone mass or arthritis and joint pain. What's going on in our bodies that causes that?
Really, starting in our 30s, we are starting to lose muscle mass. We know that we lose about 3 to 8% every decade, even that early. And that's what we call sarcopenia. Our bones also then lose density, and that can lead to what we know as osteoporosis, especially in women after menopause. Our joints also become stiffer because that cartilage, which is that cushion between the bones, starts to wear down. So altogether, over time, that can sometimes make us feel weaker or less steady as we're aging.
Is there anything that we can do to help maybe slow that process down?
Absolutely. So really the best medicine we know that's out there for muscles, bones, and joints is movement. So strength training, even with light weights or resistance bands, we know helps maintain that muscle and bone. I will say it's never too old to start strength training in my clinical practice. I have 90-year-olds. I'm starting on strength training, obviously with appropriate supervision with a personal trainer. But we know that people who stay active lower their risk of falls and fractures by 30 to 40%. We also know that adequate protein and vitamin D matter as we age immensely. We can't stop aging, but I can't tell you how important it is to keep that movement going so we can age gracefully.
You were talking about some of that starting even in your 30s. Is that something you need to start well before you're, say, older? Older is a very relative term, but that can help in advance of these issues maybe popping up.
100%. I think the sooner we can all, integrate movement and activity into our day-to-day lives, that only just translates so much further. So absolutely.
So I've got a teenage son, and I've told him, wait till the metabolism catches up with you. That's one thing that I think as you get older, you're like, wow, your body just changes quickly with that. What's causing your body to not digest those foods as well, or maybe you're just having issues with them?
Yeah. So like we talked about, your muscle mass is changing, and our muscle is a big part of what burns that calorie at rest day to day. So as we lose muscle mass, that caloric burn that we have is decreased. So that's one way that we're seeing some changes in our metabolism, but also our digestive system really starts to change. So the stomach empties a little bit slower. We may make less stomach acid. So then that affects how we digest and absorb certain nutrients. And so that's why sometimes we may have some sensitivities that we hadn't before as we age.
Say someone that's older and having issues with muscle loss or bone issues, but when is that balancing act of how much you need to work out versus the worry of maybe falling or getting injured or something like that?
Yeah, so we know that falls can have a devastating impact on older adults. So, of course, we don't want to do something that really kind of pushes somebody to fall. But, like you mentioned, it's a delicate balance. If we're not moving those muscles, we're losing those muscles. And so that's where I really tell my patients start low and go slow. So, one of the most important things I have them do is just what I call sit to stand. So, using a chair with no wheels on it, and pushing off that chair and standing up and sitting down. That's basically a squat. And we just get up less as we get older. So working on those hamstrings, those quadriceps, so important. So really just small things that you can do. You could start with 5 a day. And I have some patients who are doing 60 a day that started at 10 to 20 a day. So really starting slow, listening to your body, and having a professional help you if it's something you've never done before.
So brain health, something that's very important as you get older. What kind of changes is going on in our brain and our body as we get older?
Yeah, so some brain changes are normal. So as a geriatrician, not only do I do primary care for 65 and up, but I am also a memory specialist. And so I get often the concern about, patients coming to me sharing, well, my brain's not working the same. Some of those things can be normal. So processing speeds do slow down, meaning it might take a little bit longer for us to find the right word or recall a name of a friend from church, for example. But really kind of the things that we do day to day, balancing our checkbook, managing our taxes, those more complex tasks, those all remain intact. However, we know based on the literature, about 40% of people 65 and up might report some mild forgetfulness. The biggest thing to take away from that is normal aging can affect our ability to multitask and our memory a little bit, but it doesn't impact our independence in things we've always done and been able to process effectively.
So more on the extreme side of that, what do people need to look for with worries of dementia or Alzheimer's potentially?
Sure. So I often get asked the question about dementia and Alzheimer's and how those are different or similar. So I want you to think of the word dementia kind of as an umbrella term. And then we have subtypes of dementia, and Alzheimer's is a subtype of dementia. And so I think one of the common misnomers is that things like Alzheimer's just affect our memory. But if you think about it, our memory and our brain really controls everything that we do. So it may start with short-term memory loss, but it can affect language, it can affect mobility, it can affect swallowing. So those changes can happen over the trajectory of the disease. So we know, for example, in Alzheimer's, there are proteins that can build up in the brain and kind of damage our highways of communication between the brain and the rest of the body. And this is a very common thing that we unfortunately are seeing. We know 1 in 9 Americans, about 11%, live with some kind of dementia today. So like I mentioned before, unlike normal aging, dementia causes progressive loss of independence in day-to-day life, and that requires a significant amount of support over time.
So is there any other changes that we may see that people need to pay attention to when it comes to aging?
Absolutely. So aging can affect all of the systems of our body. I think some of the most important ones are our kidneys. So our ability to kind of filter becomes less efficient. And so that's really important when you're thinking about your medications, right? So one of the things I do as a geriatrician, especially when I see someone for the first time, is go through their med list, make sure that the medicines they've been taking really make sense for them now. They might have made sense 5 years ago, but where we're at now, does it still make sense? So that's absolutely something we see. Vision and hearing loss are also common. We know more than half of older adults over the age of 75 have hearing loss. And we're learning more and more about how that impacts social connection and social isolation, as well as memory loss. And lastly, the immune system also weakens. So we know older adults are more prone to infections like flus or pneumonias, which can be more serious. And so really the good news is utilizing our tools helps with those things, right? So exercise, like I mentioned before, wearing hearing aids, those things are very important and all can make a difference as we age gracefully.
So for people as they're aging, you'll see different people, it can impact very differently. 80 years old can look different than from one person next. Is that more genetics or just the work being put in to try to age healthily?
I think it can be a combination of both. And I think that's something we don't truly understand right now. But yes, I can have two patients with the same exact age that really present very, very differently. And that's why it's so important to do the things that we can, right? Utilize the tools that we know are successful, that kind of work in our day-to-day life to age as gracefully, like I mentioned, as we can.
Dr. Hamilton, it was very interesting stuff. I'm getting where my joints are starting to bother me. I'm gonna have to start doing some of the stuff you recommended, but thank you for taking the time to talk with us.
Absolutely. Thank you for having me.